Hello, ladies and gentlemen. I hope you're all having a great and wonderful day. Whoa, what we have here is something amazing, right? Something beautiful and amazing that we can all enjoy, right? That we can all get our hands behind, our brains behind, and do this, right? Because honestly, the big thing here is I'm gonna move this a little further back, but I gotta have it because I've been noticing that my sound on my videos have not been adequate because my mic isn't close enough to me. Oh, this is just better. But what we have here is something amazing because Trump has ended mutilation and the mutilation and chemical castration onto children because this is something that's been a huge part, and I've been talking about on this channel for a long time now. Actually, that's one of those main prime examples on why I started my YouTube channel because among of all the far left and crazy stuff that's been happening in our country, this was one of the big things. I cannot stand this, and the fact that we have this, this had to come into play in the first place, is what's crazy. So what we have here is that from Matt Walsh, technically Charlie Kirk is saying this, is that Trump's legendary start to a second term continues. This is a massive win. It also sets the stage for crippling lawsuits against the butchers who mutilated so many children. We keep racking up wins on this issue, total domination on the scoreboard. I agree. Now, I do know that there are already, lawsuits happening prior to this. This is just going to bolster those lawsuits. So that's a good thing here. And of course, Charlie Kirk has gone and say, breaking, President Trump ends the medical mutilation for our kids. Of our kids, my apologies. This will put a stop to the butchery and medieval witchcraft masquerading as healthcare. Massive. So this is what the elite says. By the authority vested in me as president by the Constitution and the laws of the United States of America, it is hereby ordered. Section 1, policy and purpose. Across the country today, medical professionals are maiming and sterilizing a growing number of impressionable children under the radical and false claim that adults can change a child's sex through a series of irreversible medical interventions. This dangerous trend and will be a stain on our nation's history, and it must end. And what have you? Oh, and we have Miss Chloe here. Miss Chloe. If you don't know who Chloe Cole is, she is an individual that suffered through these medical procedures, right? She was sexually assaulted while she was in high school, and she had this she was scared, so she wanted to change herself as, you know, normal for from victims like this that go through this kind of do. And the trans community kind of preyed upon her, right? They preyed upon her and they said you could do this to fix this or whatever after that experience. And she had a double mastectomy. And due to that, she's having a hard time most likely can't have kids because of the sterilization of the drugs and the hormones that she got. She had to try to reverse everything. It really destroyed her life for the longest time, and now she's become a detransgender advocate for it. So a little bit of history about her. I know more about Chloe Cole than history, a little bit more than some people, but that's just because I really watched her stuff. I found it absolutely disgusting on what happened to her, and I'm glad she is fighting the good fight. And that's what's been going on here. So Gays Against Groomers has gone out here. It says, massive breaking. President Trump has just signed an executive order banning child sterilization and mutilation. The days of so-called gender-affirming care for children are over. We did it. We effing did it. And we have this here, protecting children from the chemical castration and from chemical and surgical mutilation. Hey guys, this is Mr. Editing JMReports here. Mostly just because of the fact that I wrote this down and I forgot to cover this. So what we have here is that Trump signs executive order to defund youth gender affirming care. Now we have these wackadoodles as insane people pretty much saying, oh, it's gender affirming care. We have this. President Trump issued an executive order on Tuesday attempting to ban federal funding or support for youth gender affirming care. It's never affirming care. It never has been. It's an atrocious act, and that's a lie. Says the policy is the administration relates in a series of attacks against transgender people in the U.S. No, it's not. It's against mutilation of children. Quite a bit different, if you ask me. So it goes on to say here, the Trump directed the Department of Health and Human Services to publish a review of existing literature on best practices for promoting the health of children with gender dysphoria within 90 days. The department was also directed to regulate programs like Medicare or Medicaid, the Affordable Care Act, essential health benefit requirements, federally funded manuals of diseases and disorders. And they're just pretty much saying, what they're saying here is that Chase Strango, co-director of ACLU's LBG and HIV project, said in a statement, today's orders lay out a clear plan to shut down access to life-saving medical care for transgender youth nationwide, overriding the role of families and putting politics between patients and doctors. Well, you say overriding the roles of families and doctors, right? Well, here's the thing. The families had their children taken away from them when you wouldn't provide them actual medical care. So there's that. And then you have it to where you guys are just trying to mutilate children overall without really regard. It's not affirming care. It's never been affirming care. It's never been safe for children. It has been known that this stuff sterilizes people. This stuff makes them not be able to have children. On top of that, it makes them have to be forced to take pills, and there's no reverse whatsoever. You cannot reverse hormones. You cannot reverse puberty blockers at all, period. So these people are insane. And of course, we have more saying Trump restricts access to gender affirming treatment for transgender youth. No, because again, we have an 80 to 90% of people thinking that they're the actual gender after they go through puberty and stuff like that. So what you're saying is you're going to deny the 80, 90% of people that say this is, bad, right? That says that they're going to become, aligned with their gender, if they didn't take this stuff, and then you're just going to be like, oh, okay, we're going to ignore that statistic, and then make them take this, and then they spiral, right? That's what you guys are saying. It's disgusting. It's evil. These people are monsters, and I can't stand them. I'm glad that they got a huge slap in the face. This is going to severely, or if not kill their movement, as it should, and we should get better onto a path of success and victory. Goes on to say here, Section 1, Policy and Purpose. Across the country today, medical professionals are maiming and sterilizing a growing number of impressionable children under the radical and false claim that adults can change their child's sex through a series of irreversible medical interventions. This dangerous trend will be a stain on our nation's history, and it must end. Countless children soon regret that they have been mutilated and begin to grasp the horrifying tragedy that they will never be able to conceive children of their own or nurture their children through breastfeeding. Moreover, these vulnerable youth's medical bills may rise through their lifetimes as they are often trapped with lifelong medical complications, a losing war with their own bodies, and tragically sterilization. Accordingly, it's the policy of the United States that will not fund, sponsor, promote, assist, or support the so-called transition of a child from one sex to another, and will rigorously enforce all laws that prohibit or limit these destructive and life-altering procedures. 100% agree with this. I couldn't be even more proud of this actual executive order. Here's the thing, right, guys? I know a lot of young women, or knew a lot of young women, that didn't want kids in the past, right? And that's just kind of like a lot of what high schoolers think or do. And then later on in the years, not too long, maybe 4 or 5 years, getting into their mid-20s, early 20s, they want kids, right? They want to have kids. And this is the same thing here, where you're saying that these kids want to do this, which they don't really want to. They just want to feel accepted and wanted. And then this is the more sickening thing is they're mostly doing it to people that have like either bad home lives, where there's a single mother, or just no father in the home, or the kid's life is in shambles. They'll target those kids, or they'll target autistic kids with any mental deficiencies or whatever, because they're more easy to be preyed upon, right? And then on to add insult to injury, they most of the kids that are harmed by this, don't say boys are not, because they definitely are, but mostly the younger girls are heavily affected by this. They're the ones that are mostly affected by this atrocity here, and we got to do something about that, right? Because we got to do something about the kids in general, because what are we going to do when we just allow these kids to be abused, destroyed, mutilated for these transgender sick, honestly I would say sick fetish, and ruining kids' lives? It's quite disgusting. For the purposes of this order, the term child or children means an individual or individuals under 19 years of age. I would say 18 years, but I'll take it. The term pediatric means relating to the medical care of a child. The phrase chemical and surgical mutilation means the use of puberty blockers, including GnRH agonists, and other interventions to delay the onset or progression of normally timed puberty in an individual who does not identify as his or her sex. The use of sex hormones such as androgen blockers, estrogen, progesterone, and testosterone to align an individual's physical appearance with an identity that differs from his or her sex, and surgical procedures that attempt to transform an individual's physical appearance to align with an identity that differs from his or her sex, or that attempts to alter or remove an individual's sexual organs to minimize or destroy their natural biological functions. This phrase sometimes is referred to as gender-affirming care. The blatant harm done to ending reliance on junk science. The blatant harm done to children by chemical and surgical mutilation clothes itself in medical necessity, spurred by guidance from the World Professional Association for Transgender Health, WPATH, which lacks scientific integrity. In the light of the scientific concerns with the WPATH guidance, agencies shall rescind or amend all policies that rely on WPATH guidance, including WPATH Standards of Care version 8. And within 90 days of the date of this order, the Secretary of Health and Human Services (HHS) shall publish a review of the existing literature or on best practices for promoting the health of children who assert gender dysphoria, rapid onset gender dysphoria, or other identity-based confusion. Yes, I 100% agree with this, because I think that these kids need actual psychological help. I think they need a psychiatrist or a therapist or what have you to guide them into the right direction. Now, a problem is that what I've heard as well, that these therapists or psychiatrists are the ones that are coming on to the children and telling them to do the transition and stuff like that. So we got to be careful about those people. We got to select the right ones. However, I would say if those people are the ones doing that to the children, then those psychiatrists and therapists should be arrested immediately and put in jail for child endangerment. It goes on to say the Secretary of HHS is appropriate and consistent with applicable law, shall use all available methods to increase the quality of data to guide practices for improving the health of minors with gender dysphoria, rapid onset gender dysphoria, and other identity-based confusion, or who otherwise seek chemical or surgical mutilation. Defining chemical and surgical mutilation. The head of each executive department or agency that provides research or education grants to medical institutions, including medical schools and hospitals, shall, consistent with applicable law and in coordination with the Director of the Office of Management and Budget, immediately take appropriate steps to ensure that institutions receiving federal research or education grants end the chemical and surgical mutilation of children. The Secretary of HHS shall, consistent with applicable law, take all actions to end the chemical and surgical mutilation of children, including regulatory and sub-regulatory actions, which may involve the following laws, programs, issues, or documents: medical or Medicaid conditions of participant or conditions for coverage, clinical abuse or inappropriate use assessments relevant to state Medicaid programs, mandatory drug reuse reviews, Section 1557 of the Patient Protection and Affordable Care Act, Quality safety and oversight memoranda, essential health benefits and requirements, and the 11th revision of the International Classification of Diseases and other federally funded manuals, including the Diagnostic and Statistical Manual of Mental Health Disorders 5th edition. The Secretary of HHS shall promptly withdraw HHS March 2nd, 2022 guidance, document titled HHS Notice and Guidance on Gender Affirming Care, Civil Rights, Patient Privacy, and in consultation with the Attorney General, issue new guidance protecting whistleblowers who take real action related to ensuring compliance with this order. So it's very long, but I'm not going to go through the whole thing here, but you get the gist. He is literally just outright banning this stuff, removing it from existence because it doesn't need to be here. We have this here from Matt Walsh saying, Donald Trump's EO on child mutilation is without exaggeration one of the greatest executive orders ever written, and an absolute death blow to the gender butchers. One of the few things left to do is to investigate and confess criminals like Eli Elric, who are circumventing the bans by sending castration drugs illegally through the mail. Hopefully the DOJ will look into this and hold these admitted felons accountable. So it says here, I'm now a proud criminal. Trans activists boast about illegally supplying cross-sex hormones to youth by ordering 4 times the estrogen and testosterone blockers she needs and redistributing medication for free. That is insanity. Right, guys? I think we could all agree that's insanity. We should not be allowing people like this lunatic, doing things like this. This is what the trans activists do. This is what they promote, by the way. That they want to ruin these kids' lives forever. Just ruin them. And it's sickening. It's disgusting, and it needs to stop. And then we have this here from Donald Trump with his what he says here. It says, today it was my great honor to sign an executive order banning the chemical castration and medical mutilation of innocent children in the United States of America. Our nation will no longer fund, sponsor, promote, assist, or support so-called gender-affirming care, which has already ruined far too many precious lives. My order directs agencies to use every available means to cut off federal financial participation in institutions which seek to provide these barbaric medical procedures that should have never been allowed to take place. And then, of course, we have the D-Trans Reddit. We haven't been here for a very, very long time. And with these people, they're actually agreeing with this. They're agreeing with these things, and these are people that are detransitioners. This is the detransition Reddit. Now, some of them are saying like they wish they would go through legislation and be approved into law, which I can 100% agree, but you got to take baby steps, right? And I think that's what's going on here. And again, these people are started telling a couple friends, I'm slowly going to detransition. A reminder that you have 7 days to take the detransition survey, detransition advice, 4.5 years on E, 8 months of before. So yeah, these people are gone through hell. They have gone through hell. And they deserve to have a voice. They deserve to not be headed into the dark. And this is something that needs to be talked about a lot more. When I looked at this, it was like around 30K. It's going to the 56K, and it's only getting bigger. And I'm hoping that these people can find solace and peace in trying to do this, because we are trying to save these people, not what these medical butchers are doing. All right, guys, that's it for the video. Like, subscribe, share. As always, take care, my friends.
I'm disgusted by what I see in public. Even people closest to us can't be trusted, because it's algorithmic disease, the social media.